भी बात करेंगे एंड ऑफ कोर्स बियॉन्ड दैट एंड ऑफ कोर्स वो हमारे साथ जुड़ी हैं. इस दौरान अगर आपके जहन में भी कोई क्वेश्चन आ जाए, you are more than welcome to join us along with her, and let's try to connect, and let's hope she can hear us and we can hear her. Good morning.
Good morning, doctor.
Good morning, dear. Actually, first of all, thanks a lot for having me here. Yes, you can shoot the questions.
Joining us right now is Dr. Yogeeswari. If you have just tuned in, Vellore specialist, cardiologist. Doctor, there is this news that says UAE doctors call for BP checks in schools as teen hypertension soars globally. Could you talk to us a little about this now? It's a scare for most of us parents.
Yeah, I think first of all, a big shout out to all of you guys for having recognized this gap. Usually it's thought of as an adult problem, but and we rarely hear conversations surrounding blood pressure in teenagers. So first of all, a big hats off to you guys for recognizing this gap and taking this effort to bring awareness where it's actually most needed. Coming to the topic proper, if you see, globally, the teen hypertension is clearly on the rise. And if you see in the last couple of decades, we've seen an increase in the prevalence by as much as 50%. And what is concerning is UAE is also kind of mirroring the global pattern wherein teen hypertension prevalences are going pretty high. So that's something that's very concerning, and it's no more an adult disease, and definitely we have to look into it. So I think these kind of statistics really scare us, and we really have to take all our efforts in identifying it in the first place.
What are the specific criteria as a doctor used to diagnose hypertension in teenagers and adolescents? Do these actually differ from the adult criteria? Is it different?
Yeah. So actually we have 8 specific cutoffs that are available for children who belong to the middle and the higher school group. And for adults, it's usually a standard cutoff, and we have guidelines mentioning, different stages of hypertension that they get diagnosed into. But for children, depending upon their age that they belong to, so we have different cutoffs, and of course there are charts and all available, and accordingly we diagnose them with hypertension.
And because डॉक्टर योगेश्वरी, इसकी सबसे जो खतरनाक बात है वो ये है कि इसके सिम्टम्स नहीं हैं एंड इसकी वजह से ये अनडिटेक्टेड चली जाती है एंड देन फर्दर कॉम्प्लिकेशंस बच्चों में ही डेवलप होते हैं. दिस इज़ द रीज़न कि हाइपरटेंशन या हाई बीपी को ज़्यादा प्रेफरेंस दी जा रही है कि उसकी स्क्रीनिंग हो स्कूल में एज़ कम्पेयर टू डायबिटीज़, वो भी बच्चों में फैल रही है. सो इफ़ यू कैन टॉक अस थ्रू दैट किस तरह apart from screening one can figure out, and what are the symptoms that the child is might be suffering from hypertension?
So I think it's a pretty good question. We know that all along all these years we know that hypertension is actually a silent killer. That holds good even for kids. Most of them do remain asymptomatic, and they do get picked up when they go to the hospital for some other concern, to meet some other doctor, and when their routine vitals get checked, that's how it's usually picked up. But I think it's important that schools can actually play a very transformative role in this, because they have these regular checkups that's happening at the school for the vaccination assessment, for the visual checks, for the dental checks. So with the fact that the prevalence of teenage or teen hypertension going up, I think it's important to have blood pressure monitoring as an integral part of their checkup, at least once a year when they do these checkups. So apart from that, if you have a history from the parental side that they have all the risk factors, for example, they all have high blood pressure, cardiac issues. If you find that the child is probably obese, all of these can give us a clue that the child might be suffering from high blood pressure. Because as such, if you see, even most of the heart-related diseases are lifestyle-based diseases, and hypertension in teenage clearly, in its major part, is a lifestyle disease. So I think in kids who do not have a good lifestyle, I think we need to make more efforts to screen them. We should also probably be able to train the nursing counselors at the school level, because that is where the kids tend to spend most of their time. And so I think they should also be trained to identify the symptoms. For example, if all these features are there, the child is obese, there's a parent history, and if they have a very poor sleep time, they are more, eating on junk foods and everything. I think all of these will put them at higher risk for getting screened for high blood pressure at this age.
And what happens if this goes undetected, Dr. Yogeshwari? अगर हम लापरवाही बरतें और ना ध्यान करें, स्क्रीन टेस्ट ना करवाएं, तो आगे जाके बच्चों में फिर क्या और कॉम्प्लिकेशंस देखी जा सकती हैं?
So, clearly, see, all these risk factors that we talk about slowly do bring about a lot of changes in the blood vessels of our body, and they tend to take a toll on important organs like heart, the brain, the kidneys, and the eyes. These four are the main organs, vital organs, which can get affected primarily because of uncontrolled blood pressure.
Oh, wow.
Now, once it was being viewed as an adult disease, now if we identify teen hypertension and don't address it at that point of time, in few years down the line, they are prone for getting cardiac issues, which can include acute heart failures, acute heart attacks, strokes, especially bleeding within the brain, sudden visual loss, and even sudden shutdown of your kidneys. And these are all usually, devastating and life-threatening complications that we can have. So I think one thing is that it's a silent killer. So it's going to be a little difficult. You need to be a little more proactive in identifying it. Having identified it, it's very important that you take all the interventions to make sure that we don't allow it, to continue in this younger kids.
Right. Doctor, now, first things first, let's talk to you about the right markers when it comes to blood pressure. What are those? And also for the ones that know about blood pressure, immediately हम dietary changes करते हैं, कहते हैं कि reduce the intake of salt. Does that really work with kids? Will that really show a drastic change? Talk to me about the markers where blood pressure is concerned, and then we can move into dietary changes as well.
Yeah. So, the markers of blood pressure, you meant the...
like 120 on 80. What are the markers that are acceptable?
So usually, it's, as I told you, it varies depending upon the age, actually. So when the child reaches the adolescent age group, usually we have the cutoff of 130/80. But then it varies according to the different age group, and 120/80 is usually considered as a cutoff for teenagers as well. Now, having said that, yes, there are levels of blood pressure wherein we can advise these lifestyle changes to be the only intervention that we do in these people. For example, if you identify a kid who has very high blood pressure, of course, you also have to look into other factors that when young people are identified with very high blood pressure, there are other secondary causes that you look for. When I say secondary causes, probably there could be some endocrine-related causes, so kidney-related causes. All of those things also have to be kept at the back of your mind before we can directly jump on to, putting them on medications or just advising them only for diet and lifestyle.
Dr. Yogeshwari, is it reversible? Sorry, we are running short of time, so just trying to make the most of it.
Yeah, so I think the diet and lifestyle, yes, plays a huge part. As I told you, it's in teenage, clearly it's a lifestyle-based disease. But yes, when you implement all this diet and lifestyle, it's going to take a while for it to reflect on the outcomes. And I think all these diet and lifestyle changes are going to come, only the parents are going to follow because the kids are going to copy what their parents do. So I think the change should begin from the parents, right from at least avoiding excess salt-containing diet, include a lot of fruits and vegetables, cut down the screen time, avoid a lot of junk foods, avoid, get involved in more physical activities, have a good sleep hygiene. So all of these things are going to be very, very important for us to, make sure that blood pressure stays under control over a period of time.
What about the correlation between screen time, doctor, and hypertension? Is there a correlation?
Yeah, I mean, see, these are kind of interlinked, if you see, because now when you say screen time, it clearly cuts down the physical activity of these kids who would otherwise, go out to play. During
absolutely.
the days when we were kids, we didn't have this much access to gadgets or anything. So we were more running out in sunshine, playing, and then we are kind of better when compared to the current generation kids. So I think that is how it can be related. Of course, it has other effects like, the visual issues and then affecting your psychological aspect. But then beyond this, it primarily cuts down your physical activity timing, and thereby it can predispose to obesity and then, make them enable take a lot of junk foods and all. So it's kind of interlinked. It's not directly linked, but it's kind of interlinked with all these factors. Yeah.
Okay, and well, Dr. Yogeeswari, we have seen certain parents, for anything and everything, light issues like headache ho gaya, they easily pop those painkillers to children. Do you think it's okay once in a blue moon, or there is no issue at all, or what would you like to say on that as well? Easy access of
To be
medicine for children.
No way. Actually, I don't agree for this over the counter medications even for adults. And definitely not for kids, because when kids do complain of headache, it has to be taken very, very significantly, and you cannot self-treat the patients. I mean, self-treat your kids or whatever. A headache in a child has so many reasons why they can have this. So it's important we get down to the root cause of it before we can start to treat symptomatically. Because treating them symptomatically is one thing, but then we need to get to the root cause of it if we have to address it clearly.
Sure. And now with this, Dr. Yogeeswari, how soon you think one should, get serious and implement this? Of course, the government has given a green signal. So how soon do you think it's, you see in the coming days, this screen testing in schools will be implemented?
I think if you ask me, it should be implemented from today, immediately after this discussion is done. So the earlier we implement it is better, because it's just a small added thing that we're going to, do to the routine checks, which is going to go a long way. Now, apart from this, I would like to tell something interesting. There are, apart from the blood pressure machines that are available, there are certain wearables. Though they may not be very accurate in checking the blood pressure, but being a silent killer, hypertension being a silent killer, we can make use of these gadgets, to be able to identify the silent killer in the first place. Mm-hmm. So I think gadgets can be used in the right way as well, not just, in the way that
overuse.
Can affect.
Yeah. Thank you so much, Dr. Yogeeswari. Really appreciate all that you have shared with us. More health to our children and ourselves as well. That would be a winning combination. Thanks once again.
Thanks a lot for having me here, and I hope this discussion sparks a lot of awareness and people do start taking it seriously.
Absolutely. 100%. Thank you, Doctor. Well, we were discussing about experts in the UAE. Now, they're calling on schools to implement blood pressure screenings after a study found that instances of high blood pressure in teenagers and adolescents have almost doubled in the last 20 years worldwide. We're not here to scare you, but we're here to alert you and to make you know about what really is happening in and around the society. On this note, it is the Daybreak team. We are going to kind of bid farewell. Take a bow right now. Hopefully you've enjoyed today's conversation. My name is Muriel. We will see you tomorrow on this note. Bye.
Thank you so much, Muriel, Errol and Ajay. And of course, our lovely listeners, the silent ones, the callers, the ones who sent us messages and kept this energy going day in, day out. अब आपसे मिलेंगे Thursday Daybreak में. Keep it locked to Talk 100.3. अपना बहुत अच्छा सा ख्याल रखिए. And from Sobia Khan, Allah Nikiban.
Talk 100.3.
I need to open a business account soon.
Your search is over. Mashreq NeoBiz is built for now. Get your